All right, let's talk about this question right now. This question, one thing, okay, let me just start with this. One thing I want you to know is this: when NCLEX is testing you about infection control, NCLEX is testing you about what? Airborne droplet contact. Right, that's one thing you need to know. So the first thing you need to know is infection related to airborne droplet contact. Very important. Now, then when you know the infection, then you are ready to go. Now, the next thing you want to know are the precautions. Now, NCLEX test related to room, PPE, transport, right? Cohort, two or more clients together, right? Private room, right? So NCLEX also tests and hygiene. 1, 2, 3, 4, 5, 6. Right. So now, since you know all this, now the first thing you want to identify, right, is the infection. Now, impetigo, that is what? Obviously, a contact infection. Now, you are looking for the precaution. Now, another thing you want to know that is very important is because sometimes NCLEX will not give you the infection. NCLEX will give you sign and symptom or something that look like the infection. Right. It's just like right now, if NCLEX want to talk about infection of the eyes, right? Conjunctivitis. NCLEX might not tell you that infection. NCLEX might describe that infection using the sign and symptom. You should be able to recognize that that is what the NCLEX is saying, and that is a contact infection. Now, for maybe skin infection, NCLEX might just use something like lesion, something like that, right? If NCLEX want to describe it, it's you that you will not start thinking about it and say, okay, this will be related to what? Contact infection. Now, if NCLEX is talking about respiratory sign and symptom, maybe low oxygen, or the patient is sneezing, coughing, you definitely know this is respiratory infection. Now, one thing I want you to know is that airborne droplet, they are respiratory problem. Contact, they are touch problem, right? And you need to protect what? Your hand. This one, you need to protect what? The face. That is what you need to think. Now, if you are trying to protect the face, it only have to do with airborne droplets. But here you only have to protect your hand, right? Which is C. Sorry, contact. I mean, you are only have to protect your hand. So now, this is a contact infection. I'm trying to correct something you did. This is a contact infection. Now, see what you selected. You selected 2, which is definitely correct. You selected 4, which is definitely correct, but you selected 5. Now, this is contact. So, why are you selecting 5? Because place a surgical mask on the client during transport to other department does not have anything to do with what? Contact. For contact, you are protecting your hand, right? Not your face. If this is airborne or droplet, then yes, you want to protect your face, because this infection have to do with what? Coughing, sneezing to be transferred to what? Another client. But contact have to do with touching. You have to touch, so you protect your hand. So number 5 will not be answer to this particular question, right? Because it does not have anything to do with the face. So the only correct answer right here is 2 and 4, because 1, impetigo is what? Contact. We don't use surgical masks, right? For contact, yes, we use gown. Yes, we use glove. We don't close the room for contact, right? We only close the room for what? Airborne. We don't close room for droplet and contact. But this one, you must close the room. Airborne, you must close the room, but not compulsory for droplet and contact. So number 3 is not the answer. And number 5 belongs to what? Airborne or droplet. So you can see, so the answer is only 2 and 4. So make sure you note that.